Welcome to Look and Feel Your Best with Dr. Patrick Flaharty. Dr. Flaharty is the medical director at Azul Cosmetic Surgery and Medical Spa and the only dual fellowship trained facial cosmetic and ophthalmic, plastic, and reconstructive surgeon in Southwest Florida. Dr. Flaharty will spend the next half hour giving us great suggestions and some thoughtful ideas on how to look and feel our best. Today, we're going to be discussing three-dimensional rejuvenation. Yes. Hello,
hey,
good
Carly.
to see you
nice
again.
Nice to see you as well.
This is so interesting because this is going to take us kind of through the aging process, not only of how we age ourselves, but I think of the aging process of how kind of we look at plastic surgery and cosmetic surgery and how it's changed over the years, what we've learned.
Right. So a lot of what we've learned is understanding how we age. When you think of traditional rejuvenation surgery for the face, you think of lifting, right? A facelift, a neck lift, a brow lift. And those things are still important because we do get loose with age. However, a big part that's been ignored for many years is the actual physical changes to the structure of the face with age, most notably what we call deflation. Our faces actually deflate with age. We lose fat, most notably. That makes our face more hollow. And we also have the bone resorb and remodel, so our facial bones change with age, and even the muscles shrink. And so a lot of what you see over time is this deflation of the face, loss of fat, bone, and muscle that leads to hollowness and sagging of the face.
And this is what is so interesting, because I think when we look back, 20, 30 years ago, when people were starting to get more facelifts done and they weren't looking great still after that. I mean, is that why? Was this big piece of the puzzle not being looked at?
That's one of the reasons, yeah. Like nowadays we'll see patients coming in who have had one or maybe two facelifts, and they come in for a consult regarding a facelift, and you'll look at them and the skin is tight and there's sun damage and there's very little volume in the face, so they're basically look skeletonized because all the bony anatomy is showing through because we've lost all the soft fat. When you look at a youthful face, a young, beautiful face, it's soft and it's full. It's not tight. And so really tightening has its downside, and repeating tightening operations can certainly be a negative. It's not really the answer for a lot of these patients.
So this is why it's an exciting time to certainly talk with you today, and to certainly be in the medical field to see where the changes have taken place relatively pretty recently.
Right, so the technology now to replace volume is there. I mean, it wasn't as much in the past. Fat augmentation, which we're going to talk a lot about today, using your own natural living fat cells to replace the lost fat cells of the face, is really the state of the art, the best way to replace this volume. It is a surgical procedure, but we now have non-surgical options as well, such as fillers and products like Sculptra, which is a biostimulator that can build collagen over time and can be done with injections in the office.
So when you are looking at the face, I mean, where are the certain areas on your face that need the fat, that need that extra kind of fill?
Yeah, what's interesting, if you look at a face, often when we look at rejuvenation, the upper third of the face, the brow and upper lid, can often be rejuvenated with a brow lift or blepharoplasty. And of course, the lower face and neck, lifting helps to tighten the looseness of the jawline and neck. It's the middle third of the face that is the most important area, because that's where we lose so much volume. We get hollow around our eyes, we get dark circles under the eyes, you start to see the cheekbones, and the tissues just sag. And so that's, when we do fat augmentation, I put fat in all parts of the face because we lose it in all parts of the face. But I think the most important areas are the upper and lower eyelid, cheeks, temples, and then even jawline. And then we'll do fine areas like the lips and around the mouth as well. But it's that middle third that's really important, the eyes and the cheeks.
Do you generally do this with other procedures as well? Would somebody just come in to just have,
fat augmentation?
Yeah.
Yes, sometimes that's the case, but most of the time it is with other procedures. As I mentioned to you earlier, the patient who's coming in for a third facelift, and I see this all the time, and they may have sun-damaged skin and they're hollow, and they're not necessarily loose because they've already had several lifts. Sometimes we'll do fat augmentation to fill the volume. and then a laser to tighten the skin, and that's a great combination procedure. It's really, there's no cutting or stitching with that at all. We just add fat back to the face to replace that lost volume and use the laser to tighten the skin, which gets rid of the sun damage and wrinkles. But many times patients will be coming in for first-time lifts, and in those cases we might consider doing like a brow lift, eyelids, face and neck lift, and fat. I mean, I consider fat a core part of facial rejuvenation, because really if you lift and you don't fill, you're missing the boat, as we've discussed. You still end up with a hollowness around the eyes and the temples and the cheeks. So if we can do fat at the time of surgery, it helps almost everybody.
Does it help, you know, it's so important when we have something done that it doesn't look like we've had something done. We, you know, again, just want to look like our best self. Is it easier? I mean, what's that challenge like in putting fat back in the face to making sure that you still look like you, but just a more youthful you?
Yeah, that's a really good question. And the thing is, I think fat helps people look more natural, okay? Because if they're really thin and you're tightening to get rid of the looseness, you still have a tight, thin face. It's not really natural or youthful. When you add fat back, you soften it. You give some third dimension to the face, you know, those round cheeks, like you have, Carly, those beautiful round feet. But that's the idea. I mean, that's a beautiful, youthful feature, is high, soft cheekbones, which aren't the bones you're seeing, it's the fat that overlays the bones. And so people look a lot more natural when you do fat. It gives them a healthier, more youthful look and a very natural way. And one of the things we do is we have the patients bring in some of their favorite photos from their youth, and we use that as our template. So when I'm replacing fat, I'm looking at what they look like when they were 20 and 30 and trying to match that pattern. Because obviously we all age a little differently. We start at different points. And so we use that as a template to add the fat. And typically you're not going to end up going back to age 30 with the volume, but it's somewhere in between where you're at now and where you were then, which generally looks really nice.
I would be curious too if someone's had some weight loss recently, and sometimes, you know, that's one part, they look fantastic, but yet something is different with their face.
Right.
Is that in correlation at all? I mean, do you see that?
Yes, all the time, you know, and that's, you know, unfortunate because, you know, you're losing weight, you're doing the right thing for your overall health, but as you know, people who are really fit tend to have thin faces because they lose fat in their face as well. And so, you know, in those cases, you know, adding volume back can be very helpful. And as I mentioned, you know, fat augmentation is a great procedure. When people ask, what's the best filler? I always say it's fat because it's your own natural living tissue. And that's an important point that people don't recognize. When we use fat, we take it typically from the abdomen or flanks, we spin it down in a centrifuge and we concentrate those fat cells, and then we layer them into the face where you need them, and those cells that survive, which is about 70% of them, will be actually living cells that'll stay there for many, many years. And so it's living tissue, it's your own natural living tissue, it looks and feels natural, and it'll last for many years.
That's what I was gonna, how long does it last? Is it something that has to be redone?
Well, not typically, no, but you do continue to age, so you'll continue to lose fat from your face, and the bones and the muscles change, but by restoring some of that lost volume, you're turning the clock back in terms of the volume in the face. So, and then we can always use fillers. You know, fillers are great because they're non-surgical. You can do them in the office, and they can last up to 2 years in some cases. So even people who have fat down the road will probably have some fillers to help maintain it. So that's another option.
How do you manage people's expectations? Because I'd imagine that must be something, you know, we bring in a picture of what we look like, you know, when we think we looked our best. I mean, that's got to be a big piece of the puzzle in making sure the results they're happy with.
I think patient education is the key thing there. You know, we have a lot of pre and post-op pictures, and we have patients who'll meet with other patients to show them kind of what they look like. That's really helpful for them to see what's going to happen, how they're going to be changed, and what the expectation should be. There's a lot of education that comes with this, and that's really important prior to going into surgery to do anything. Make sure they are clear about what we can accomplish and what we can't accomplish.
Because I know we've talked about it before, where you look in the mirror and you think, you feel a lot younger than maybe what you see, staring back at you, and that's what you're trying to do.
The look and feel your best concept is really great, because I hear that all the time. People, we're living longer, we're working longer, we're staying healthier, and people are more invested in their health and longevity than ever before. But unfortunately, aging keeps happening. So as far as the physical changes to our face and body, and so many times people will say, wow, you know, the way I feel inside is very different than what I see in the mirror. And if that's the case, there's plenty of things we can do, you know, there's a lot of options.
That's why I like that term rejuvenation, right? Because I mean, it's not necessarily, you know, taking, you know, years off, but you want to feel better. You want to look better.
Right, right. Just helping people look the way they feel, look a little more rejuvenated and, yeah.
Well,
healthy.
we're going to take a quick break, though. What do you want to dive into next when we come back?
We can get into a little more of the 3D facelift and what else is involved with that.
And if there's pain or anything, kind
We
of
can talk about
discomfort,
that
we
too.
have to go there, doctor.
Yes, we have to talk about it.
So stay with us. We'll be right back.
I wanted to look as young as I felt, and Dr. Flaharty knew what I meant. It was so easy and quick, and I did it on my lunch hour. Now I just feel as happy on the outside as I am on the inside.
Look younger today with Dr. Patrick Flaharty. Visit azulbeauty.com or call 239-415-7576. Naples, Bonita Springs, and Fort Myers.
Dr. Flaharty, thank you for giving me my youth back.
I had bags under my eyes for over 30 years. So that's why I first came in. And then I talked to the doctor about my wrinkles because they really disturbed me. I know we're getting older, but I want to get older gracefully. I can't believe how good you look. I mean, all my friends have said that. My old co-workers where I retired from cannot believe the result. I feel like I'm young. I like my look, and I feel more confident in the way I look.
2,200 corporate reports 3 teenage daughters, 135 sunburns. You've earned every one of those wrinkles, but it doesn't mean you have to live with them. Look younger now. Call Dr. Patrick Flaharty today.
Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. All right, so today we've been talking about three-dimensional rejuvenation, and now we're really going to dig in and talk about how we can get this back, this youthful glow back. With fat augmentation, which is so interesting, how were we able to place that and kind of break down the procedure, what you're actually doing?
Yeah, so interestingly, it is minimally invasive in the sense that there's not a lot of cutting with this procedure. What we do is we harvest fat from wherever you have extra, and typically that's the lower abdomen or flanks, and most people have a little bit of extra there. We're all fairly well insulated, and it's just delicate liposuction to harvest the fat. We usually harvest about 120 cc's, 2 syringes of 60 cc's of fat. And so that's just gentle liposuction. We do obviously contour those areas to the desire of the patient in the sense of, okay, if they have more fullness in the lower abdomen, we can take it from there, or if it's more flanks, we can take it from there. And then we spin that fat down, and it's really interesting when you do centrifuge fat, you get a concentrated fat plug, and that has a lot of stem cells and growth factors in it too. So this is doing more than just adding volume. It actually rejuvenates the tissue around it, including the skin, which is nice. But once that's done, whatever we're doing surgically with the patient, let's say we're doing a brow lift and a face and neck lift, we'll be doing that part as the fat is being processed. And then at the very end, the last stage of the procedure is when I'll put the fat in to reshape the face, to add that third dimension. You know, fill in dark circles, lift the cheeks, fill in the temples, upper eyelids, jawline, and lips, and areas around the mouth. So typically, you know, we'll do all areas, and then how much I do in each area is based on that person's face and what we're trying to accomplish.
You said a buzzword I think people are interested in hearing more of is stem cell, and you talk about using your own fat. I mean, are we really seeing that seems to be where today's kind of procedures are going with how beneficial that is when we can use what's already in our own bodies?
For sure. It's more natural, it's longer lasting, and there's some really good, you know, the stem cells and growth factors, which we don't totally understand yet, but we know they have a really positive effect in the healing in the skin. It's amazing when you do fat augmentation, it looks like the skin is much healthier after, even when you do nothing to the skin. You're just adding fat, and all of a sudden, you know, filling helps because you're, you know, the analogy I use with fat augmentation, which is, you know, I love, is, you know, when you start life, you are like a balloon full with air. And as we age, we lose air, and so it becomes saggy. And so you're really adding that volume back to restore that youthful volume in the face.
Which, in what we talked about earlier, when I think people, for so long thought that's how you fixed it, was just to, you know, tighten and pull back, and now we're seeing the importance of actually filling.
Right. So much of it is, you know, that third dimension. So, you know, brow lifts are great, face and neck lifts are great, but you still have this face that's deflated and shrinking every day. And so if you do nothing to restore that lost volume, then you've missed a big part of the, you know, aging changes and the, you know, so adding the volume back does give you a true rejuvenation, because then we can add fullness to the upper eyelid and lower lid and temples and cheeks, and provide that soft, full, youthful face that we like, that's really healthy and young versus just a tight face.
Told you I was going to come back to it. We have to talk about pain, discomfort.
Yeah.
Talk about the procedure, what people can expect when they have this done.
Yeah, so the liposuction is small volume liposuction, so there's very minimal discomfort. We do put a little garment around them just to keep things tight, because we want it to flatten. We want them to have a good effect from that. But that's minimal discomfort because it's just a small area. The fat placement really doesn't cause much discomfort either, because the fat is placed with blunt-tipped cannulas, which are not needles. We make tiny little puncture wounds to be able to place the fat, and we do it through tiny cannulas that are 0.7 to 0.9 millimeters in diameter, so really, really small, because the key to success with fat transfer is getting small little clumps of fat cells becoming vascularized by your native tissue. So you don't squirt it in like a toothpaste. You place it in tiny little parcels at a time in the deeper layers of the face, into the muscles and around the deeper fat pads, to augment those. So that fat has to become vascularized within probably 48 hours for it to survive, or it'll die and disappear. And so the technique is to put a little bit in a lot of places so that it becomes vascularized and survives. But that doesn't really cause much discomfort, because you're really using this blunt-tipped instrument that's very small to layer the fat into the areas you want. Because you do a lot of little passes, you typically do get a fair amount of swelling. You know, you typically have some swelling in the cheeks and pretty much all the areas. So I always tell patients you're going to look overcorrected at first, because you have the fat plus the swelling. The face is going to look pretty puffy for the first week or two. Most of the swelling fades in the first couple of weeks, and then you lose a little bit of the fat over the course of a month or two, and then you have, you know, the stable result of whatever survives, which is...
It is surgical. Are patients awake? Are they completely out? I mean...
Pretty much all the surgery we do now is under IV sedation with local anesthesia, so that's, you know, an important point. There's big advances in anesthesia care now, so we don't need to put people to sleep or use breathing tubes anymore. You know, in most cases, most patients, we just do IV sedation, you know, fully monitored anesthesia. We do have board-certified anesthesiologists at our site. They oversee the care of all patients, so it has the highest level of credentialing and safety. But we don't need general anesthesia, which means patients wake up quicker, more clear-headed, less hangover effect from the anesthesia.
You mentioned swelling. How soon do you see results? I mean, does it take for that swelling to go down, and then, I mean...
Well, you know, it's interesting. What typically happens is you'll end up a little overcorrected, because the face will be kind of swollen and puffy. As the swelling starts to go away, you hit this sweet spot where it's just perfect, and you want to freeze it. But most of the time, you'll continue to lose a little bit more and end up a little undercorrected. And I think that's kind of what most people are comfortable with. As we talked earlier, you know, they don't want to look different. They just want to look refreshed and rejuvenated. And so I think, you know, a little bit of undercorrection in terms of the volume is perfect. You know, you're not making them look different. You're just making them look healthier, more youthful, refreshed.
So who do you think the ideal patient is then to really look at this particular, you know, form of fillers and getting that back? I mean, is this anybody, you know, that's having something done that may want to additionally have this as well? Is it...
Yeah, I think when we analyze the face for aging changes and options for rejuvenation, you know, that's an area we look at. There are patients who need rejuvenation, such as brow lifts or eyelids or face and neck lifts, who have full faces. I mean, we're all built differently. So there are patients who don't need much volume. If it's a small amount of volume, if we're just trying to enhance the cheekbone area or fill in hollow temples or dark circles under the eyes, we might elect to use fillers, because that's easier, it's more practical. But if they are have a lot of volume loss, moderate to mild to moderate, then fat can be really great because you can do much more. So, for example, a typical fat augmentation case, I'll do 40 to 60 cc's of fat. And if you came in for fillers, we might do 2 cc's of filler at a time, or 4 maybe. So we can do a lot more volume in one setting, and that's, again, the advantage of doing fat. It's kind of a one-time only procedure where you can kind of correct all the volume all at once.
Talk about some of the before and afters that I know even you still enjoy seeing. You know, you've been in the business for years now, and that's got to be so rewarding to see patients so happy with the results.
Well, this in particular, I think, over the time of my career, you're always kind of scrutinizing your results and looking at things and, trying to figure out what's the best result for that procedure. But, before we started really using volume to replace lost volume, again, that whole area was just missed, And so now when I look at patients who we do everything on, the three-dimensional rejuvenation, it's remarkable how good they look. I mean, not only healthy and young, but natural too, because we've given them back that soft, full, youthful look to the face that goes away with age. And so volume is extremely important, and in many cases, even when we're doing brows, face, and neck, I think the key is the volume. If I was to pick what's been the most effective part of this, it's been the volume we've replaced to the cheeks, because that gives them this healthy, youthful shape to the face that looks great.
How do you help decide? I know a consultation is extremely important. That's obviously the first step. But I know some people may be nervous to say, okay, I want all of this done, or they may say, well, let me just start with this. I mean, how do you help decide what is the best plan of action? Because as we've talked about, so many people, we're unique, we're different.
Right. So the big growth in our field has been in non-surgical options, with light lasers and injectables like Botox and fillers, and so many things we can do now in the office. And so typically when we do a consultation, we'll list for the patient all the things we think that can be helpful, both surgical and non-surgical. And it's quite common nowadays that people will start with some non-surgical things like Botox or fillers or skin care. And there's a lot we can do even in the non-surgical realm. And there's certain things we can't do. When you get to the point where your eyelids are really heavy, or your neck is really loose, or the brows are drooping, there's certain things that require surgical intervention to fix. But there's many things we can do non-surgically for just about everybody. So it makes it easy for people to put their toe in the water and see what they think. And most of the time, they'll find it's effective, and then they might progress to more things over time.
When it comes to three-dimensional rejuvenation, where do you think, the next step is? I mean, is it still with kind of the augmentations and is this kind of the direction is going, or where do you see the future of this?
Yeah, I think so. I mean, I think people want natural results. The idea of using your own natural fat. I see continued improvement in the technique for fat survival. We're seeing more and more fillers being done in the office, and those work great. But beyond a certain point, they can be a little unnatural. And you see that just like overdone lips, overdone cheeks now. You'll see people have had too much filler in the cheeks, and it doesn't look or feel quite natural. So I think, fat tends to look and feel more natural. And so I think refinement in the technique such that we can get more predictability, better survival of the fat is going to be one thing we'll see. And we're understanding stem cells and how that works to rejuvenate the face and skin. We're going to probably see better techniques to do that, to help the skin rejuvenate as well.
It's pretty exciting to see, and I feel like also more people are willing to come in and call, both male and female, I would imagine. Well, are you seeing kind of an increase in number?
Yeah, I think it's more accepted now. We see, we were laughing about, our kids grew up, Botox is a common thing, right? I mean, they know Botox from when they're little kids. So, when they get to the age where they need Botox, it won't be like a big deal, right? We had to kind of learn that. And so I think things are more available, more accepted, and because there's so much more we can do non-surgically, there's an easy entry point for, anybody. And so I think you see just a higher utilization of these services and products because they're more available, more affordable, and, people are more aware of them.
We've talked about expectations before. What's the best thing to do if someone's watching today and they think, okay, I am ready, But what's the best way to manage expectations, and especially when it comes to the three-dimensional, making sure?
Yeah, well, I think a consultation is a great place to start. When we start talking about three-dimensional rejuvenation, that's sort of the pinnacle of what we do, and I consider that to be a one-time event in somebody's life. Ideally, if they've never had any surgery, you can do a one-time procedure.
What age are we talking? I mean,
well,
I know it differs, but
yeah, it differs, but it's often in the 50s or 60s or 70s nowadays. We have more and more patients in their 70s coming in for first-time facelifts, which is pretty interesting. And so, if it makes sense to you, doing that all as one is great, and I consider that a one-time event. So you have everything, it's done. You don't have to come back for more surgery. Just continue to do skin care, take care of yourself. Maybe you do some Botox and fillers as you need to, but everything else is office-based. So kind of in a perfect world, you have that one full rejuvenation. You turn the clock back and then just maintain it for the years to come.
What do you say to those who are a little bit nervous about the word surgery? Or, it's different. I think people, especially for something cosmetic, how do you ease their nerves? I mean, do you see that? I don't know. I'm assuming that's what happens.
Yeah. People are nervous about surgery, naturally so. And, I think that's appropriate. But, it is safer than ever. I mean, our techniques are better. The anesthesia is better. The procedures are quicker. Recovery is shorter. So everything about it has gotten safer and better. So, there's a time and a place for it. There's a lot we can do non-surgically, so it's nice to know you can start with non-surgical, and maybe that's all you'll ever do, and that's okay. But when it's time for surgery, if there's a problem you want to fix that requires surgery, it's safer and quicker than ever before.
Something else we haven't even mentioned yet is your team, and I know you're very proud of your team. Certainly locations all throughout Southwest Florida.
Yes, we have a fantastic team. I pinch myself every day because our staff is phenomenal. And we do have offices in Naples, Bonita Springs, and Fort Myers, and a superb staff, not only all the nurses, but the front desk girls, as well as our star providers. We have nurse injectors, as well as laser specialists in our offices as well. So we offer a full complement of products and services, and a growing group.
But it starts with a consultation, right? Maybe someone's watching this morning and says, or today, and says, you know what, I'm ready. I want to do something. I want to look better, feel better.
Yeah, and it's not intimidating. Consultation is, if you've seen the show and you mention you've seen the show, there's no charge. We'll do a thorough evaluation and we'll give you a lot of good information. And from there, it's up to you to decide which things you want to pursue.
Well, again, I love that your passion is education. You want to make sure that viewers are informed and they're educated. They know to come to you and ask questions. So, Dr. Flaharty, thank you so much for being here today.
Thank you, Carly.
For chatting. Yeah. So we hope you enjoyed today's show of Look and Feel Your Best with Dr. Patrick Flaharty. To contact Dr. Flaharty for a consultation and to find his offices, visit azulbeauty.com. He has offices in, like we said, Naples, Bonita Springs, and Fort Myers. The phone number, if you want to give his office a call, is 239-415-7576. That's 239-415-7576 or azulbeauty.com.
Thank you for joining us. We'll see you next time.